It's time for our health segment, and joining us now is Africa 54 health correspondent Lino Mudu with an update on coronavirus. Hello, Lino.
Hello, Esther. That's right. As the coronavirus continues its deadly assault on Hubei province, Chinese health officials reported Tuesday the number of confirmed cases from the COVID-19 outbreak now tops 72,000, with the death toll rising to nearly 1,900. Tuesday's update includes 98 more deaths and over 1,800 new cases of the virus that is straining China's healthcare system and causing authorities to lock down areas in an effort to stop it from spreading. China's state television reports that one person who died from the virus Tuesday was Liu Ziming, the director of Wuhan Hospital in Wuhan, the epicenter of the outbreak. World Health Organization Chief Tedros Adhanom Ghebreyesus says that Chinese data from recent days appear to indicate a decline in new cases.
This trend must be interpreted very cautiously. Trends can change as new populations are affected. It's too early to tell if this reported decline will continue. Every scenario is still on the table.
Ghebreyesus says more than 80% of patients have a mild form of the disease and will recover. Wuhan and Chinese cities are being quarantined. We spoke to one African student, Suhaila Saif, a native of Tanzania, who is currently pursuing her medical studies in Wuhan. Take a listen.
We are living in fear. We are tired of being worried. Everything has paused. We don't know what's going to happen in the future. We are afraid to go out to find food, to find necessities that we can keep up with our daily life. The school has made this system whereby every day in the morning we have to report our temperatures and our health. If you're feeling good or if you're not feeling good, you have to report to the teacher. And this will keep up with everyone who is at risk. They will know what to do after that, and they have also given us community hotlines so that we can contact them in case of emergency. They're doing their best to keep us safe, but we're still not feeling safe since when we are running out of items, we are forced to go outside to find food and gloves and masks. This is a very bad situation for us.
A student from Cameroon living in Jiangsu is the first African known to be infected with the coronavirus. Chinese health officials say the student has recovered. Thousands of African students, workers, and families remain in lockdown across central Hubei province. The WHO says there are 794 confirmed cases outside of China. Some 444 cases have been passengers on a cruise ship under quarantine in Yokohama, Japan. The U.S. says it has evacuated more than 300 of its citizens and their immediate family members who had been on board of the Diamond Princess vessel. All of the U.S. evacuees are being held under quarantine for an additional 14 days. Now, in a new report released by the World Health Organization and the International Agency for Research on Cancer, experts warn that if current trends continue, the world will see a 60% increase in cancer cases over the next 20 years. The WHO says the largest increase in new cases, about 81%, will occur in low and middle income countries, where current survival rates are the lowest. In 2019, more than 90% of high-income countries reported that comprehensive treatment services for cancer were available in the public health system compared to less than 15% of low-income countries. The report says, among other reasons, countries have had to focus limited health resources on combating infectious diseases and improving maternal and child health, while health services are not equipped to prevent, diagnose, and treat cancers.
At the disease burden, the NCD take the majority of the share of the global disease burden. That's That's almost same for every country as well. Even for the African country, we understand probably infectious disease will be number one, but it's not true. We have a lot of data from African countries. Over 60% of disease burden come from the non-communicable diseases. That's why we think that we have to work together more closely and invest more on non-communicable diseases, including cancer. We absolutely call the countries, when they look at primary health care's strengthening and the package, make sure that cancer, including all the cancer intervention and diagnosis, treatment, and other health technology can be absolutely packaged in the universal health services in the country.
The WHO highlights a wide range of proven interventions to prevent new cancer cases, including controlling tobacco use, vaccinating against hepatitis B to prevent liver cancer, and vaccination against HPV to prevent cervical cancer, as well as early screening for prostate cancer. A lot of people are surviving cancer because new treatments have become more effective. But there's one thing that stands in the way for many people, and that's having the money to pay for cancer treatment. VOA's Carol Pearson reports that at least one hospital in the U.S. is working to make treatment more affordable.
Have you been feeling well? Yes.
Medical care in the U.S. costs more than it does in any other developed country.
Breathe in and out.
That means surviving cancer can empty a patient's bank account. When Tori Geib got her cancer diagnosis, she thought she would be okay financially.
I just went on what they said to do. And at the time, I had really great private insurance.
3 weeks later, her great private insurance stopped covering her medication.
And I said, well, how much will this be just to get through for the month? And they said, for the 1 month supply, it's $11,000.
That's about average for new cancer therapy in the U.S., but to make the situation even worse, it was only one of 13 drugs Geib needed. The astronomical cost of cancer treatment causes many patients in the U.S. to try to save money at the expense of their health.
1 in 4 cancer patients actually report engaging in some risky behavior to try to save on costs. So either skipping refills of medications or even splitting doses.
Start off, hi there.
A financial counselor at the Cancer Center helped Geib find a way to pay for her treatment.
We've helped over 30,000 patients gain access to grant funding or manufacturer assistance program with a total value of over $500 million.
The hospital also introduced a new program that keeps these expensive medications from going to waste. Patients can now return pills they don't need.
We put that medication into essentially a repository where we wait for the next patient that has a financial need so that we can redispense that medication to another cancer patient.
The program helps patients focus on getting well and not stressing about their finances.
There's so much stress that goes along with this diagnosis, and you really want to try to minimize that stress along with the cancer. And this is one thing that has been given to me that I'm so thankful and grateful for.
Kennerly Shaw says the goal is to start out small and then to expand the program to cover medications for other diseases. Another goal is to provide a model that other institutions can copy so more patients can afford their treatments. Carol Pearson, VOA News.
And that's our health report for today. To stay in touch, find me on Twitter at Lenore Moulou. Esther, back to you.
Thank you so much, Lino.
Sure.
All right, be sure to watch Lino Moudou's health report every Tuesday on Africa 54.